Joining us to talk now more is pediatrician Dr. Joel Gator-Warsh. Dr. Warsh, thank you so much for joining us. Appreciate your time.
Thanks for having me on.
So I understand, look, several states have confirmed cases, including those in California, your home state. How concerning is this for you?
I think it is a bit concerning. I mean, I think that we need to be monitoring this and we want to make sure that it doesn't get out of control. There certainly have been measles cases over the last decade or so, almost every single year, but we certainly don't want the outbreak to get bigger because measles can be very serious.
What do you make of the vaccine skepticism and hesitancy that's been growing in this country, particularly since the COVID-19 pandemic?
I think it's something that we really need to look into more thoroughly. And I think it's really important that we have thorough discussions about vaccines and risks and benefits. And certainly we want to make sure that people are getting the information that they need so they can feel comfortable to take vaccines if that's something they want to do.
Well, HHS Secretary Robert F. Kennedy Jr., he's been branded anti-vax or at the least a vaccine skeptic. He was in a cabinet meeting and questioned about measles, and he said it's his top priority, but also said it's nothing too out of the ordinary. Let's take a listen to that sound, and I'll let you react.
There have been 4 measles outbreaks this year. In this country last year, there were 16. So it's not unusual. We have measles outbreaks every year.
Also, 2 opinion pieces in the Wall Street Journal and the New York Post have called on the secretary to really use this as a moment, use this as an opportunity, this awful thing that has happened to this poor unvaccinated child who's lost his life, and say, show us your worth, your salt, show us that you have come around on vaccines, and come down to Texas and tell people that this is what they ought to do. They said, I think that it says something about a jab in the arm is a jab of love or something along those lines. Do you think he should go to Texas, and how do you think he should handle this?
I think if things continue to spiral out of control, certainly he should go down there. I think that any sort of outbreak is a top priority for the HHS and the CDC, and we want to make sure that we get it under control so that way we are not having more people come down with measles. Most people that get measles, it is quite minor, which is great, but certainly measles has the, certainly sometimes it does get very serious, and we want to prevent that from happening.
Yeah, look, I mean, it can cause brain swelling, blindness, death. At the same time, you know, hopefully the symptoms would be less than that. You wanted to talk a little bit about vitamin A and how that can impact symptoms?
Yeah, I do think it is really important that we should be talking not just about vaccines. I think vaccines are important, but we certainly need to take an opportunity to talk about our greater nutrition and health. With the pandemic, we certainly talked about vaccines a lot, but we know that vitamin D was very important. Vitamin D levels were very important. We know that nutrition can be extremely important. And with measles, there is a lot of research that vitamin A deficiency is intimately related with severe disease, and making sure that we're getting appropriate nutrition, appropriate vitamin A actually makes a huge difference. And so I do think we want to mention that. We want to talk about our general health as well, because whether it's measles or any infection that comes our way, having good nutrition, eating well really is what will help you to be the most resilient. So I think that is really important that we focus on that as well, because we do have a chance now to focus on our general health. We're talking about measles, we're talking about infections, we're talking about health, and we want to talk about all these things, not just vaccines.
Dr. Joel Gator-Warsh, thank you so much for joining us. Appreciate it.
Thank you.
Thanks for watching. Go to joinnn.com to find NewsNation on your screen. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.